collaboration with the Cyprus Mail. This is the Cyprus News Digest with Rosie Charalambous.
Coming up this week, the story of occupied Phlamoudhi village is turned into a film.
Now Phlamoudhi is a community that exists in the mind, and for anybody who has ever known or personally been displaced, it is a very moving story.
We'll meet the locum priest at St. Paul's Anglican Cathedral in Nicosia, who's over in Cyprus from his home in Jerusalem.
Escalations happen, I think, because sensitivities are very raw. And therefore it doesn't take much to scratch the surface, and suddenly events just sort of roller coaster, and people are caught up in that because I guess principles and ideals and ideologies suddenly take on a new meaning when someone is hurt or killed or there's purposeful violence on one side or the other.
And we'll be talking at length to the Minister of Health about the implementation of Cyprus National Health Service.
It will cover all people living in Cyprus. It will be socially fair because everybody will contribute based on their income.
Well, joining me on the programme today we have an author and a filmmaker. Welcome to Ian Colne, who's written the book all about Phlamoudhi village, and Rupert Barclay, who's made the film. Ian, let's start with you. What's the book about?
The book is a photographic essay of pictures that I took in the summer of 1972 when, as a graduate student in architecture, I had been invited to become the photographer for the Columbia University Archaeological Dig that was situated in the small village of Phlamoudhi on the north coast of Cyprus. In my spare time, I wandered around the village, was befriended by the villagers, some of whom I worked with on the archaeological site, and found that at the end of the summer I had photographed almost all of the inhabitants. I had been invited into their homes and had had a wonderful time. Went back to the States, made a small exhibit of this at Washington University where I was a student, and then put my pictures in a box, where they remained pretty much unknown until, thanks to the serendipity of life and in particular my experience in archaeology, the archaeological aspect of the work that was being done at Phlamoudhi was reinitiated in the year 2000, and in the year 2005 there was a symposium in New York. A friend phoned me and said, "I've just seen your photographs. Why weren't you there?" I got reintegrated into the world of archaeology, found myself at a dinner one night with Pavlos Florentzos, who was then the director of the Cyprus Museum. He took one look at my photographs, declared they were a national ethnographic treasure, and that he would mount an exhibition in the Cyprus Museum, in tandem with the archaeological work that was to be exhibited in the summer of 2009. Between 2005 and 2009, I was introduced by email to a former member of the Phlamoudhi community, a young man named Savas Georgiou, then living and still living in London, who was 8 to 10 years old when I had photographed him with his family. Savas and I got together in London, and through Savas I learned that my photographs were the key to the past for this entire community, which had left on a moment's notice when the Turks invaded, left everything behind and had nothing to show of their past lives. It was a wonderful journey for me, this 3.5-year or so exploration of who the people were in the picture, who the houses belonged to, but it was only the second step of this journey, because when I came back to Cyprus and was reintroduced to all these people, with at that time a book that I published of the photographs, I really discovered how deeply important it was to all of them. Along the way, I discovered that these photographs held a lot of emotional value to Cypriots of all manner, because it showed a way of life that had been lost.
Rupert, if we come on to you, you presumably, I understand, are connected with Phlamoudhi, but how did you get to hear about this book and decide that it needed to be made into a film?
Yes, that's right. So Savas Georgiou's cousin is my wife, and it happened that in 2009 Ian was giving a lecture in North London, which I went along to. And there was the presentation with the photographs and the story behind everything that had happened. And I found it fascinating, really moving, in fact. And I have been involved in television for 10 years, and I thought to myself, I want to make my own film, and I think that this is a really great subject to make it about. This is a great story.
So how did you approach it? Because turning the emotion that Ian was talking about there for the people who are no longer in their village, and I'm sure a lot of them probably got copies of some of these photographs just because they've lost their own mementos. How did you approach it for the visual side?
Well, I interviewed all of the people who are alive still, who are in the photographs that I was able to interview. Otherwise, I was able to interview their children. And when you talk about the emotion, certainly it's all there. I don't need to manufacture anything. If anything, I needed to rein it back a bit. It's certainly when you put a lens into someone's face and you ask them to talk about a past like this, it really brings these emotions out in people, actually. So sometimes you have to try and manage this way. You have to manage this by reining it in a little bit, in fact.
Have you both been up to Phlamoudhi on this visit?
I haven't been to Phlamoudhi this year, but I filmed in Phlamoudhi. When I first started making the film in 2011, I went up there. I had permission to go up there, and I filmed around the village with a couple of the characters in the film, and we were able to explore and have a look at
what sort of state is it in now?
Well, some of it is not in a good state, but some of it is. I gather in the last few years there's been quite a lot of reconstruction. Certainly for a long time it was not in a good state, and certain buildings that are key in the film are ruins, but some of the buildings have been restored.
Now, where are you hoping? I mean, Ian, great for you, obviously, to have this work of yours put into another medium where it will reach possibly a whole new audience. Rupert, who are you aiming this at? Where are you hoping it's going to be shown?
Well, certainly here in Cyprus, I'm wanting to show it in film festivals, perhaps on television, wherever I can do. I would like this film to be seen. It's a wonderful story. I also want to show it in the UK and wherever else there will be an interest for it. I want to get it out there, spread it as far and wide as possible.
And Ian, your thoughts finally? Is this the end of the story of Phlamoudhi for you?
I never knew when the story really began, and I don't know that I know when it will end. But I do know this. The story of Phlamoudhi is not unique to Cyprus, and the film that Rupert has made is not simply about the group of people who once called Phlamoudhi their home. Phlamoudhi in 1972 was a community rooted in the soil. Now Phlamoudhi is a community that exists in the mind, and for anybody who has ever known or personally been displaced, it is a very moving story, and one that is, I think, universal in its character. And Rosie, let's remind your listeners that if they're interested in the original book, they can purchase it at www.facesofphlamoudhi, spelled PHLAMOUDHI.com.
Gentlemen, thank you very much indeed for joining me. So look out for the story of Phlamoudhi. That is Ian Cohn and Rupert Barclay. Thanks.
Thank you very much.
Listen online to the Cyprus News Digest on YouTube or at cyprusmail.libsyn.com. The latest program is uploaded every Friday, and if you missed one, you can catch up there.
Lawrence Hilditch has just taken over, for a short time only, as the Dean of St Paul's Cathedral in Nicosia. He's with me on the programme today. Lawrence, nice of you to join us. You work normally, I think, in Jerusalem, so what's brought you to Cyprus?
Okay, well, the Bishop of Cyprus and the Gulf has asked me to do a little bit of locum work in the cathedral, so I'm here really for 6-7 weeks, just as at the end of one ministry, and then in the interregnum leading into the other. So I was curate here in the congregation, so it's lovely to be back again amongst all the people, and it's just a joy to be here serving for 6 or 7 weeks.
And then back to Jerusalem, where I think you're headmaster of the school?
Yeah, back to Jerusalem, all being well mid-August. I'm the director of the Anglican International School in Jerusalem, and I'm superintendent of St George's Cathedral School in the east of the city. So I sort of work between the east and the west of Jerusalem.
Now, obviously, with the current situation in Gaza and indeed in the whole area, life must be very difficult. Can you just give me your impressions?
Wow. I think I probably have learned several things since going to Israel and Palestine and to the lands of the Holy One. That's what I like to call them, because then it's quite neutral. I've learned that basically if you go to Jerusalem for a week, you can come back home and write a book. If you go for a month, you write a paragraph. And if you stay for longer than that, it's very hard to say or write anything at all, because the situation is just so complex. I'm very privileged in that I'm the Bishop of Jerusalem's Minister for Reconciliation, so I work on both sides of the political and religious divide. So I work with Jewish believers and I work with Arab Christians as well. So it's a very, very interesting place to be. And basically, if I was to say anything, I think the majority of people really just want to get on with their lives, be with their family, and live alongside their neighbour. Escalations happen, I think, because sensitivities are very raw. And therefore it doesn't take much to scratch the surface, and suddenly events just sort of roller coaster, and people are caught up in that, because I guess principles and ideals and ideologies suddenly take on a new meaning when someone is hurt or killed or there's purposeful violence on one side or the other. And really, both sides are hurting. I have very good Palestinian friends, I have very good Israeli Jewish friends, and they're all hurting and they're all afraid at the minute. And they really long for peace.
Do any of them come up with suggestions as to how that peace could be achieved?
I think there's a variety of things going on at a very low level, where people are first of all just meeting together and beginning to understand that whilst there is a lot that divides them, there is also a number of things that unites them. There are a number of things that they have in common, a number of things that I guess are places where people can start to talk. I come from Northern Ireland, as you can probably hear from the accent, and I think one of the things we had to learn in Ireland was that one side had and held a certain truth. The other side also had and held a certain truth. And what was true on one side for one people might have been different to what was true for others, but it was still that group's truth, if you know what I mean. And I think there are a number of people in Israel and Palestine who are coming to the realization that, yeah, this is true for me. But what I need to start to do is to listen to someone else's truth, which is very painful, because to listen to someone else's truth means that your side is criticised. And to actually listen to that truth and to understand hurts, perceived or otherwise, is a way to go, I think, in a whole peace process. And there are a number of people who are engaging in that sort of a dialogue. But it's long and it's slow. And situations that are erupting today don't really help that dialogue to flow. And it just becomes more difficult.
In collaboration with the Cyprus Mail, this is the Cyprus News Digest with Rosie Charalambous.
And now some good news if you're an expat living in Cyprus. Do you want an easier way of making contact with friends and family back home? Well, if you're tired of trying to arrange Skype dates with loved ones only to be frustrated by poor quality and delayed and awkward conversations, then the Cyprus News Digest has the answer. We've teamed up with the Expat Phone Company to offer you a 1-month free trial of the EPphone service. You'll get a real physical telephone for free that simply plugs into the back of your internet connection. Once it's plugged in, it's connected with your own personal UK phone number with a UK area code of your choice. Friends, family and colleagues in the UK can call you on this number without paying international call charges. With EPphone you get professional business-grade call quality without any hidden charges. You can also make phone calls with your EPphone. Just dial any number in any country and your call will be charged at the local rate of that country, saving you the huge international calling rates charged by your current phone provider. You can sign up for this trial at www.epphone.com. That's EPFONE.com. You simply enter the promotion code CND in the relevant box to waive the first month's low service charge. This is the Cyprus News Digest, making your life easier and cheaper with EPphone. Check www.epphone.com.
Get in touch with the Cyprus News Digest by emailing cyprusnewsdigest@gmail.com.
The Troika has just finished its 5th review of Cyprus, and the Health Ministry came out with flying colours because it's been implementing a national health scheme, something that's been on the cards for probably a couple of decades here in Cyprus, but it seems we are now much closer to the desired end. With me on the Cyprus News Digest this week is our Health Minister, Philippos Patsalis. Philippos, thanks for joining us. Can you start by explaining exactly how this national health scheme is going to take shape? Because there are plenty of different models you can use, aren't there?
Yes, it will be a new NHS system which will stand on 4 pillars. The one is that it will be Catholic, so all citizens, they will declare, basically all people living in Cyprus, they declare that they have a permanent address in Cyprus, regardless if they are Cypriots or not. They will be obliged to participate in this NHS scheme, so it will be Catholic, it will cover all people living in Cyprus. It will be socially fair because everybody will contribute based on their income, so the rich will pay more, the poor will pay less, and everybody will pay irrespective of what it will cost or the risk they have, the health risk they have. Children and unemployed will be covered by the government. The third pillar will be that they will have the freedom of choice of who will provide them the medical service, private sector, governmental sector, any doctor or any hospital, they will have the freedom of choice. And the fourth will be economically viable because it will be based on the contribution of employees, employers and the government, so it will be a budget that will have to cover basically everything.
So does that mean that, let's say, I get sick, I have my presumably national health card or whatever, I go, to a GP first, and he says, you need specialist treatment, who do you want to go to? And then I go away and see who is in the field doing this sort of thing and say, I would like Dr. So-and-so, and then it's fixed.
The system will start as a single-payer system, in other words, with a national insurance company that will cover all participants, And in the future, it may open to private insurance companies as well. But it will start as a single company. We will, as I said, maybe convert it to a multi-insurance if this is something we feel that it provides the benefits to the citizens. So you have to contribute an amount from your salary, as well as your employees in the government, and the system will have agreement with all the hospitals in Cyprus and medical providers. As a citizen, you will have to choose your primary doctor.
General practitioner.
The general practitioner. For children, the pediatrician. And you have to choose one. You have to register. Of course, you may change if you don't like, but first you have to go to this medical practitioner, and he or she will provide you the necessary services. If you need services from a specialist or a hospital, then he will prescribe for you to go, but then you have the choice to go to any hospital you like.
But mostly you'll take the advice of your GP who says, go and see Dr. So-and-so.
It's totally up to you. So you have the freedom of choice.
This is a little bit of a departure from the way so far Cyprus has used any health services, in the sense that there is a tendency here for patients, if they've got, I don't know, something, they think they've got something wrong with their heart, they don't go to their GP, they go direct to a cardiologist. So this is going to be a sea change in the whole way the system works.
That's true. This will be a change. Of course, the system will allow any citizen to go directly to a specialist, but the citizens have to pay a co-payment. Let's say 30% of the cost will be paid by the citizen out of the NHS system as a co-payment.
That's if they go on their own to a specialist.
So it gives the right to go, but then you have to pay a little bit more.
And what will you pay for a visit to your GP?
At the moment, we are at the stage of making the agreements with the providers and finalize the fees. The fees on the doctor will be finalized with the doctors, and the fees for the DRG are the diagnostic related group, is the payment for a surgery or for an operation, or for a service that involves something more than a doctor. This is a system that is internationally accepted, and therefore we will agree the DRG payment with all the hospitals. But what is important is that we will also change the system and move to electronic health. Everything will be electronic. The charging on the one side of the insurance of the Cyprus, from the governmental insurance, let's say, as well as all the services at the hospital level. Prescriptions, paper for entering the hospital, release the hospital, clinical examinations, MRIs, laboratory examinations, all information will be electronic.
So patients will have electronic records, basically.
Yes.
And will they be accessible to all the different healthcare specialists?
Yes, and it will be accessible from any point inside or outside the country.
Right, now then one thing people will immediately say is, how secure is that going to be? People are very, very touchy about their medical conditions being common knowledge sometimes.
Yes, we will follow the international practice and the international standards that other countries have done this before. We will follow the good practices. So for any citizen that will visit the primary doctor or the secondary services at the hospitals, it will be, even though the system will be very, very complicated, an NHS system is very complicated, and also the supporting, the infrastructure, all this may be complicated, but for the citizen it will be simple, because he or she will go to the primary or the secondary doctor, giving the ID, and then as a member of the NHS system will be covered by anything, including medical services, hospitalizations, drugs, MRIs, laboratory services, whatever. So if you will leave the hospital without paying anything, the hospital will get paid by the NHS system. If you go to any drugstore, you will give your ID card and get your drugs, and again, you don't have to pay anything because everything will be covered.
Right, now that's interesting because the other thing, of course, that you're well aware of is the story that's been ongoing about the price of pharmaceuticals in Cyprus. And if they stay as high as they have been, presumably that would be a huge drain on the new National Health Service.
Yes, the pricing and reimbursement of pharmaceutical is a major issue, not only for the citizens because they pay now a lot of money, and we expect that with the NHS system the prices of drugs will go down, but also for a country, for any country. As you know, the pricing and reimbursement is of pharmaceutical it's a complicated issue. In every country they deal this with slightly different way, and it may cost in Cyprus 200 millions or 20 billions. It depends of how you set up the pricing system.
It also depends on which drugs are approved for use, because in England you have NICE, the Institute, I think, for Clinical Excellence. Do we have, or will we have, something similar here? Because
yes.
There again are the pros and cons of such a body,
yes.
in terms of seriously ill people sometimes not getting the drugs they need because they're considered to be too expensive.
Yes, that's true. You will need such organizations in the country. We are setting up this system now, and we are in close contact with NICE because it's a UK, but it's an international organization. And actually, I have here the president a few days ago, and we are in close contact. We also are in close contact with other experts through WHO, and we will set up a system that will cost more or less about 200 millions. That is already the cost. With this amount of money, we can have a good standard. You can choose drugs, or you can have a system that will cost you 10 times or 100 times more. So countries are very careful about it. It's not whatever the patient needs. It's also whatever the system permits. And you always try to find the balance between the cost and the needs of the patient.
Right, and the big question, of course, is how long before this actually gets implemented? We seem to have come closer than we've ever been. You do have a plan. I'm not sure it's gone to the Cabinet yet, or it's going any day now. Once it's passed, what's next before you roll out our new national health system?
As you said, it's more than 20 years now that we're making studies and taking decisions at the level of the Parliament, and many decisions at the level of the Council of Ministers that either have been cancelled or remain without implementation. During the last months, we set up a new plan in a new effort. Fortunately, we are moving forward. In the last month, we already implemented several decisions through the Council of Ministers. We currently prepare new legislations that are needed, or changing the legislations, and these will reach the Parliament, be approved before the end of this year.
And then the actual setting up of the whole system?
The plan is to implement the new NHS system in 3 phases. The first phase will be 1st of July 2015, where we are going to cover only the primary care, pediatricians and general practitioners. On January 1st, 2016, we will introduce all drugs and specialized doctors. And on 1st of July 2016, everything.
Including inpatient care?
Including inpatient care and everything else.
How is it going to work when you've got phase 1 in place, but phase 2 and 3 are still on the old system? Is that going to create any problems?
Well, the old system it will be there until it's diminished. It's a system that works. It doesn't work very well, but it's there. We cannot abandon it. We are just going to introduce on the top of it, phase by phase, the new system.
And of course all citizens will have to find out, I presume, that you'll issue a list or something, who is their nearest general practitioner, because in some areas I presume they'll be oversubscribed and in some areas undersubscribed.
Yeah. You touch a very important issue. Currently we are working on all the healthcare centers we have in Cyprus. In Cyprus we have 43 healthcare centers that they provide many services, including the primary care. We also have sub-centers in remote areas of Cyprus to the number of 200, I think. So what we are doing now in this month, we are looking all the areas of Cyprus, they do or they do not have these medical centers, and we take into consideration the number of people living in the area, the infrastructure, the existing infrastructures, the commute between the neighbor towns or villages.
So the catchment area, basically, and how long it will take.
We also evaluate if private doctors, they have offices there, because if they do have, it's one thing. If they don't have, then the country, the state, have to assign somebody, because we have to have general practitioners in local areas.
So what would you do? Assign government doctors who are currently, let's say, in a hospital to somewhere in a rural area?
We will restructure this system of primary cares, taking into consideration all this, and establish new or abolish others, or help by support some other existing centers. So in all Cyprus, again taking into consideration the region, if it's in the mountains, if it's an area close to a big town or a small town, the number of the population, all these parameters. So all Cypriot citizens, they will have access, they will have an easy access. We will also use telemedicine. We also use electronic health, because you don't have to go to the doctor to get your drugs, your prescription. You can do this remotely. And we will also use community nursing, and even provide transportation for some areas.
It sounds as if it's a huge task, but you're sounding as if you feel you're well on the way to achieving it, and you've got, actually, for the first implementation, just under a year, I think, until we see it rolled out. I hope we'll talk again, maybe at the beginning of next year, to see exactly how things are progressing.
It's a very difficult task and very complicated, and this is one of the reasons that it was not implemented for the last 20 years. I call it mission impossible, but I think we cannot afford to not to implement, regardless of the difficulties. So we are very determined, and we work hard towards this goal. I hope we have the consensus needed with all the partners, because as a big and complicated project, it's something that there will be a lot of conflicts between participants and parties. So regardless of this, we will move forward, and we will look for the maximum consensus. But the priority is to put the citizen, the patient, at the center of our effort, and to implement this project because it's needed for the country. Unfortunately, Cyprus has a lot of inequalities in the area of health, and as a modern country, as an EU country, as a country that we consider ourselves developed, we have to offer to our citizens what is needed, which are medical services throughout their life of good quality.
Well, there we are. That was our Health Minister, Philippos Patsalis, on the imminent introduction of the new Cyprus National Health Scheme. Well, that about wraps up this edition of the Cyprus News Digest. Many thanks for your company. Hope you'll join me next week. Till we meet again, take care and God bless. Bye-bye now.